Welcome to the Pandemic plus Racism equals Genocide webinar, sponsored by Freedom Road Socialist Organization. I'm Sol MARQUEZ, member of Freedom Road in Los Angeles, and I will be moderating today's panel. I'm a working class Chicana doing serious and protracted work to help free Chicanos from national oppression. Our two speakers today will be Masao Susuki and Frank Chapman, and each of them will be speaking for 15 minutes first. You may ask them questions via Facebook, YouTube, or Twitter, and at the end of their talks, I will ask them some of your questions. We plan on making this no more than an hour, but we may go longer if needed. Thank you for joining us. We hope you are keeping yourself and others safe during this scary and uncertain time. A very real and global pandemic is spreading and disproportionately hitting entire groups of people, more so than others. Today's webinar will be addressing this. In the southwest of the U.S., or Aslan, Chicanos like myself are seeing numbers increase at alarming rates. The U.S. had plenty of time to prepare as China warned the world of the dangers of coronavirus. Instead of reacting in a serious, planned, and beneficial way, the U.S. leaders like Trump met the virus with levity. Now that the U.S. has gone from bad to worse, Trump's only solution has been to attack immigrants. The numbers do not lie. The pandemic began in 3 places: Washington State, New York, and San Francisco Bay Area. At the U.S. and Mexico border, there were no cases, but this hasn't stopped Trump. His recent attack was not to take ownership for his dismissal of COVID-19, nor a swift opening of factories to make every single person in the U.S. masks or respiratory devices, nor to freeze rent costs, and much less to distribute food or essentials to the people, like they are doing so in Venezuela, Cuba, or Vietnam, even though China was the first to show us how to do this. Instead, Trump in the U.S. isn't doing anything of this kind of magnitude, despite being completely capable of it. No, instead, Trump's solution is to put a stop to immigration. We understand what he really is trying to say. Chicanos, Mexicanos, and Central Americans are the people he and his supporters picture when they think of immigrants. Trump has a long history of attacking Latin America, and especially immigrants from Mexico and Central America. His entire campaign has been fueled by the oppression of our people. Even the stimulus money, which many of you have already received, is unavailable to so many of us. Anyone who is married to an undocumented person is ineligible to receive the stimulus. The website itself is inaccessible to a lot of people. My own mom, who is eligible, needs my help to file it because the website starts welcoming her in Spanish, but then the application itself turns into English only. Detention centers and concentration camps were some of the first places to be hit by the pandemic. We have been demanding that these facilities release the detainees in order to save them. Deportations and ICE raids have not stopped during this time. In fact, some cities have seen a direct plan to raid the undocumented because we know that we are home. They know that we are home. These are only a few of the countless ways that this powerful country is attacking the millions of people who make it thrive. Chicanos in working class neighborhoods like mine, Boyle Heights, had no coronavirus testing facilities. One just opened within the last 2 weeks. Numbers were low, but since the opening of this facility, the cases are quickly rising. Neighborhoods like mine will be the hardest hit, and when the dust settles, the magnitude of our dire situation will clearly be visible. The time is now to rise, to stand up and fight back. As oppressed nationalities like Chicanos and African Americans are seeing the largest and scariest results of what the rich and powerful U.S. will not do to help us, we have each other to count on. May 1st is International Workers' Day, a communist tradition around the globe in which the working class takes to the streets and plans for significant change, even for revolution. In my neighborhood of Boyle Heights, we are taking the pandemic very serious. We are not letting it stop us from organizing. Other places will be doing the same. Staying safe but fighting back at the same time means that you can organize. You can organize caravan protests, webinars, and other innovative ways to keep active. We have to continue being safe and preventing the spread of the virus, as well as fighting for the very people who are most affected by the virus and the racism resulting in our genocide. We thank you for joining us today, and now we will begin our panel. Our first speaker will be Frank Chapman. In 2019, Frank Chapman, along with Angela Davis, led the refounding of the National Alliance Against Racism and Political Repression, in the prior 7 years as field organizer of the Chicago chapter of the Alliance, he launched the movement to demand community control of the police through legislation for an elected Civilian Police Accountability Council, or CPAC, which now has the support of 40% of the members of Chicago City Council. He just published his first book, The Damned Don't Cry, Pages from the Life of a Former Prisoner and Organizer, and will be releasing his second book soon on Marxism-Leninism and the Black liberation struggle in the U.S., published by Freedom Road Socialist member. Frank is a member of FRSO's Central Committee. Thank you, Frank.
I'm on mute. Okay. Wow, I really had it going on. Sorry. Okay. I want to begin by saying in the so-called war against COVID-19 in the United States, we have witnessed a basic truth about war in general, and that is war is politics and politics is war. Under the guise of war against the coronavirus, the White House is waging war against the people, and especially against the nationally oppressed and the working class. This means, for executing this war against the people are blatant lies and flagrant racism, particularly against the Chinese people, while ignoring the fact that COVID-19 infections continue to spread, creating already a death toll of over 50,000. We know now that a disproportionate number of the dead are Black. In the fight against COVID-19, it is said we can count on science to tell us what it is as an infectious disease and how to behave to contain it and stop it from spreading among the vulnerable and then to society as a whole. As Reverend Barber put it, the coronavirus seeks and spreads with a quickness in the fissures of society created by inequality. At this stage of the outbreak, detection, vis-a-vis testing, then tracing, treatment, isolation, and social distancing is the only option we have when combating an incurable disease that spreads sickness and death. Now we have to pose a question that is almost never posed in the White House, Congress, state houses, or city halls, and that is, how can you effectively test, treat, trace, isolate, and social distance in a society that profits off of sickness and death? In a society where if you don't have the ability to pay, then you die. The answer is obvious, but unacceptable. In a pandemic, everyone must be and should be tested and treated in order to save lives. But what makes the obvious answer unacceptable is that since we are living in perhaps the richest and technologically the most advanced society, then why can't we do better? Why did we come up short of masks, PPE, and hospital beds? With the greatest health industrial complex in the Western world, why are we the world's epicenter in sickness and death? Profits before people is the answer. The basic contradiction of capitalism is socialized production versus private appropriation. That is, the wealth produced by the working class masses is appropriated and lavishly consumed by the monopoly capitalists. Thus, we are the only society in human history where poverty exists in the midst of plenty. When the market is glutted from overproduction of food, then food is destroyed and farmers are paid not to produce. When hospitals don't show profits, healthcare workers are laid off and hospitals close down. Such is the nature of the fundamental crisis perpetually produced and reproduced by the capitalist imperialist system. The largest geographical region in the United States is the South, and over 52% of the Black population lives in this region. In terms of poverty and low wages, these former slave states are on the bottom rung of the social ladder. In terms of healthcare, it is the most underserved section of the country, and yet 9 out of 14 states that did not expand Medicaid were in the South. Also, the premature reopening of businesses, entertainment, and sports is concentrated in the southern states. It's like throwing gasoline on fire, and Black people will die in the greatest numbers. It is no accident that for months we got no demographic data from any level of government regarding the spread and death tolls of the coronavirus. As of April 12th, 38% of the 194,000 cases reported in 29 states had no demographic breakdown of the data. Here's the picture we got at that time from the COVID tracking project at the Anti-Racist Research and Policy Center in Atlanta, Georgia. And I quote, "But at this point in the pandemic, the disparities between the size of the Black population and the percentage of Black people infected with hospitalized or dead from COVID-19 appear to be the most severe. A Washington Post analysis found that majority Black counties had infection rates 3 times the rate of majority white counties. A Center for Disease Control and Prevention analysis of nearly 1,500 hospitals across 14 states found that Black people made up 1/3 of the hospitalizations, despite accounting for 18% of the population in the areas studied. An Associated Press analysis of available death data found that Black people constituted 42% of the victims, doubling their share of the population of the states the analysis included. In Louisiana, more than 70% of the people who have died so far from COVID-19 were Black, more than twice their 32% share When did you stop hearing me? Okay, 20. Okay, let me just start this again. Okay, well, what I was saying was in Chicago, 70% of the death toll is Black. And in Cook County Jail, just a few weeks ago, we had the highest rate of infections in the country. In Illinois, Black people made up 15% of the state's residents, but 56% of people in prison. More than half are drug dependent. Total prisoners are 41,000 in state prisons, 23,000 in local jails, and 9,000 in federal prisons. There are 15,000 in juvenile detention. We don't have a number for immigrants held in detention. There are about 500 prisoners, mostly Black and Latinx, who are in the state prisons as a result of being tortured and forced to confess to crimes they didn't commit. We organized a car caravan protest of 100 cars last Monday to demand the release of Gerald Reed and all the torture survivors, as well as the elder prisoners made, prisoners with urgent health care problems, women who are pregnant or with urgent health issues, as well as juveniles and immigrants held in detention centers. As part of the National Alliance, we have also issued a national call for all our people to join the demand to depopulate the prisons and jails and detention camps now. In our work with mass organizations and in all our organized activities, we must lift up the issue of how this pandemic crisis impacts on Black people and all oppressed and all nationally oppressed people, and demand that special support be given in terms of economic assistance from all levels of government. We must demand testing, tracing, and treatment in our communities. Presently, most of the testing is being done in high-income neighborhoods and wealthy districts. Hospitals that service Black and brown people are understaffed and incapacitated due to lack of beds, masks, and PPE. The economic support packages coming out of Congress are so structured where assistance starts at the top with big business, then goes to the middle with small business, then trickles down a little to healthcare workers, a little less to essential workers in commerce and industry, delivery services, and public transportation. And then finally, next to zero for the 140 million people who live in poverty in this country. Already the shutdowns have generated more than 25 million unemployed. Already a food crisis is imminent with the closing of food plants and the pandemic hitting agricultural areas. Already with late stimulus payments to people living from paycheck to paycheck, workers in the urban poor could be facing massive evictions. In summary, we are in a free fall to an economic collapse that will dwarf the crisis of 2008. So we must start getting ready so we will be ready for the whirlwind. We must make every conscious effort to connect with the movement of the masses, and we must initiate actions that will move masses. Why I think we should raise the question of genocide. It's all over the media now that Black people, Latinx, immigrant communities, and indigenous people are the most vulnerable due to pre-existing inequalities. It's true, we are the most vulnerable, but it is also true that what is killing us now is present government policies. The deliberate and premeditated failure of a federal response to this pandemic, not to mention the failure to expand Medicaid in the Black Belt states and the neoliberal policies of cutting Medicaid in some northern states like New York. Government needs to address the issues aggravated in our communities by this pandemic. Their failure to do so is tantamount to genocide. We must organize and fight back. We must become the socialist organization which leads the masses as opposed to the socialists who are pushed by the masses. We must be the front lights, not the tail lights of the people's movement. We need to intensify the struggle to end racist and anti-working class policies now in order to guarantee that we don't go back to the racism and the social savagery of capitalism that made us vulnerable in the first place. We're not fighting for a return to the status quo of yesterday, but a new day and a pathway to liberation and socialism. Thank you.
Thank you so much, Brother Frank. That was an amazing, amazing speech. Free them all, and may we continue being in solidarity with our Black brothers and sisters. I do want to say that, keep putting in your questions if you want to ask them. We will ask those questions to our panelists, Frank and Masao, right after of the talk. Next up, we have Masao Suzuki. Masao is a leader of the Joint Nationalities Commission of Freedom Road Socialist Organization. He is a professor of economics at Skyline College, a community college just south of San Francisco. He has been teaching economics as a tutor, graduate student instructor, and professor for almost 40 years. Professor Suzuki has been active in the Japanese American community in the San Jose, California area for more than 30 years with the Nihonmachi, I hope I said that correct, Outreach Committee, NOC, and more recently helped to organize the refounding conference of the National Alliance Against Racist and Political Repression, NARPR, in November of last year. In 2010, Suzuki was visited by the FBI as part of the raids and federal grand jury subpoenas aimed at anti-war and international solidarity activists in the Midwest. He is a frequent writer for Fight Back newspaper and is a member of the Freedom Road Socialist Organization. Suzuki lives in San Jose, California, where the first known death from COVID-19 pandemic happened in early February. Thank you, Masao.
Thank you, Sol. And it's always hard to follow Mr. Chapman in a talk, but I'll do my best. Just a couple of comments about the impact of the pandemic on oppressed nationalities. Frank talked very extensively on African Americans, and then also Sol in her introduction talked about the impact on Chicanos, Mexicanos, and Central Americans in the Southwest. I just wanted to add that other Latinos, especially in New York City, where there's a lot of Puerto Ricans, Dominicans, and other people from Latin America, their communities have been hit extremely hard. And that I think one of the things that is happening is that the perhaps fortunately for the Chicano nation, it's been a little further away from the original outbreaks, which did occur in here in the Bay Area. Actually, it was in my county, Santa Clara County, near Seattle and New York City. But at the same time, it is gathering force. The coronavirus infections and death, for example, are growing much more rapidly now in Los Angeles, which is the largest city in the Chicano nation, and in California, and one of the largest in the country, and much faster than here in the Bay Area. So I think, unfortunately, in another month or so, we'll see statistics on that. Two other groups, Asian Americans have been hit harder than whites by the pandemics in terms of their death rates, not as hard as Chicanos and Latinos or African Americans, but still at a higher rate. But we've also had to face increased attacks aimed at Chinese and other Asian Americans that, in the worst case so far, a family, including a 6-year-old and a toddler, were physically assaulted and attempted to be killed in Texas. And this is a reflection of both the long-standing anti-Asian racist sentiment, as well as Trump and other leaders or misleaders here in the United States trying to blame China for the failures of the handling the pandemic here. The last thing I wanted to mention, not last thing, but in terms of the pandemic directly, is that Native Americans are also being hit very hard. It really is uneven depending on where you are in the country. But for example, the Navajo Nation is the site of a very bad outbreak, and these communities have among the lowest incomes, shortest lifespans, poorest health cares in the country. And unfortunately, it's a sort of long-standing practice that the US government doesn't report accurate and timely data on Native Americans. And so they are sort of stuck in the other category, along often with sometimes with Asian Americans. And so there isn't really good nationwide data, but I think we'll be finding, unfortunately, again, once the virus gets to some of the native lands, the outcome is going to be very, very bad for those people. I was going to mainly focus on the economic impact of the pandemic and how that's affecting our communities. The economy is definitely in the greatest crisis since the Great Depression of the 1930s. Close to 30 million people have lost their livelihoods just in the last 5 weeks, and this is about 20% of the entire labor force. I think one of the things to remember is that the economy was really not in good shape, especially as it concerned working people and oppressed nationalities before the pandemic began. It was good for the capitalists, for the rich, for the 1%, as corporate profits were at record highs, and the stock market was also at record highs even earlier this year. And while unemployment was at 50-year lows, more and more jobs that were being created were low-paying, part-time, temporary, or gig work, and about half of all workers had no savings and more relied on borrowing to survive. And so what this means is that the crisis has left people without any means of, more and more people without any means of support. You see photos of lines with hundreds and thousands of people lining up at food banks. You see reports that millions of people were not able to pay their rent in April or pay their mortgages. And this is just going to get worse in May. The only good nationwide data available is still only related to March. We'll find out about more about the April situation for different oppressed nationalities on Friday, May 8th. But initial reports do show that Latinos and Asian Americans were hit hard by the early layoffs in the hotel and restaurant and many service jobs that were first hit by the pandemic. Now there's both massive layoffs, and too many oppressed nationality workers are caught between the two evils of either being jobless on one hand or working in unsafe conditions on the other. And lastly, I want to mention another development that is going to be upon us very soon. It's sort of a third wave. We have the pandemic and the death and suffering that it's causing, and that's still happening. The rate of infections in many centers are starting to, as they say, flatten out. But this doesn't mean that more and more people aren't getting affected and more people are dying. Then, of course, we have the economy, the economic crisis, which again, perhaps the peak of the wave of layoffs has been hit. But the fact of the matter is that the latest report showing 4 million people applying for unemployment benefits in 1 week is basically only eclipsed by the 2 previous weeks and is much higher than any previous record. And that third wave is the wave of austerity that we're starting to see coming upon us. About 80% of local governments and state governments are reporting that they are facing budget shortfalls because as people lose their jobs, they lose income tax revenue. As people stop going out and businesses close, they lose sales tax revenue. And about half of all cities and counties are reporting to have started planning for budget cuts this summer. And this is only what counties are reporting. There's probably many more who are not reporting this, who are not making plans, but that doesn't mean they're not in a budget crisis. So we will see cutbacks in schools, libraries, local services, transportation, and including healthcare at the local and state levels. I personally, and of course I don't know the future, don't expect a lot of austerity from the federal level to begin until after the November election, since it is an unpopular thing. But there's already growing resistance to trying to blunt the economic impact of the pandemic on, especially on cities and counties and states. There was a opinion written by Lindsey Graham, Republican senator and Trump ally, warning about the dangers of deficits. And of course, then there was a Republican Senate leader, Mitch McConnell, talking about, oh, well, maybe states can declare bankruptcy. And the meaning of that is that, does it mean the states won't pay their debts? No, what they're talking about is states being able to break union contracts and also break pension promises. So it's an attack on public workers, educational workers, and all their retirees. What was I going to say? This will hit oppressed nationality communities very hard. That's what happened during the last Great Recession back in 2008, following the financial crisis. Black workers in particular have a lot of public sector jobs and were hit hard by the cutbacks at the local and state level. All of our communities, Asian, Latino, African American, Indigenous peoples, will be hit hard by the any cuts in the services that will be coming about as the pandemic and the economic crisis unfolds. I do want to echo what both Sol and Frank said about the importance of trying to figure out all means of struggle at this time. It is difficult in this time of physical distancing, but it's been very inspiring to see the protests. I've watched some of the protests coming out of Chicago, car caravans, and other types of actual physical protests that I think have a lot of impact beyond just the virtual discussions that a lot of are engaging in today. Thank you again very much, and I'll look forward to hearing some of your questions.
Thank you so much, Masao, for giving us such insight on what's happening, of course, all around the country from the perspective that you just gave us. I do want to say that if you are tuned in now, please make sure that you share us, because we would like to have more people given the opportunity to ask some questions if they have any. And we have been noticing that many of you have been asking really great questions. And Masao and Frank, if it's okay with you all, I'll start those questions now. The first one that I'm going to go ahead and go with is, what advice can you give us on organizing during this period? Whoever wants to take it first.
Well, I'll take it since it's hanging. Yeah, that's a good question, because it's a challenging question, given that we are in a pandemic. And let me tell you what we've been doing here in Chicago that might help you. When we organized our last car van demonstration, which over 200 people participated in it, by the way, we convened on the church lot, and we issued, before we even got there, we put out very stringent rules about social distancing. We required everybody to have a mask. In fact, we brought over 100 masks with us to pass out to people who might have forgot to put one on. And we asked people to respect, being 6 feet apart and so forth and so on. And that people in cars together should also be people who live together. So these were this was the discipline that we imposed upon ourselves. And so we carried out that discipline throughout the demonstration. When we first left the church parking lot, we had about 50 cars, and by the time we got to the main building where the governor was having a press conference, it's called the Thompson Center, we had over 100 cars. So people are ready to protest, but we strongly suggest that in mobilizing and organizing these protests, that we practice social distancing and we have people wear masks, because we don't want to facilitate the spreading of this disease.
Excellent. Thank you, Frank. I completely agree with that. And Masao, would you like to take a crack at that same question?
I'll pass, Sol. I think Frank has more actual experience in organizing during the pandemic. I could rant about trying to teach online, but that's not the topic for today.
Thank you so much to you both. And we have many questions, but I'm going to go ahead and select another one. Let's see here. It looks like the indigenous communities have also been affected by the pandemic. Would any of you like to answer how it is that the indigenous communities are being affected at this time? Okay, I can definitely speak to that. There have been different articles that have come out throughout the country. And of course, as we know, a lot of tribes have been affected already in terms of the disproportional way that the U.S. treats, people who are indigenous in this country. And what does a pandemic look like for these particular communities? It's also very, very extreme. There are people who are dying in alarming rates, and I believe the Navajo Nation is one of those tribes that is vastly affected at this time. And it's similar around the world, actually. So I would say that they are also affected by this. When we talk about oppressed nationalities like African Americans and Chicanos, we're also talking about others who, aren't rich and aren't white, who are affected by this. If you've been watching some of the people who pay attention to like celebrities, for example, they really are above kind of like feeling the situation because they can stay in their very comfortable living situation, as opposed to people who are forced to go to work or are having to have their children be home during this time. But yeah, thank you so much for that question. There are a couple of others. There's actually quite a bit. So I'm going to go ahead and move it on to the next one. It looks like there was an LA Times article that recently came out. And in the article, it seems that there was, a specific section that talked about Blacks and Latinos and how the death rates are affecting those who are younger as well. Between the ages of 18 and 49, they're seeing an increase of deaths. Is this anything that you all have found similar in your areas, that it's not just really like people who are older that are being affected, but also the younger people who are Black, Latino, or other nationalities?
Yeah, well, here in the Illinois area, there's a lot of younger people who have been infected, including infants. But also, a lot of our young people are in juvenile detention centers, and those have become hotbeds for the spread of this virus. Some of the young people have been released from Cook County Jail, but the majority of them are still in there, and that's also another hotbed. But we don't have any any real data on it because releasing any, you know. It's like for a long time, it was a whiteout on the data concerning the number of black people and other people of color who were being hit by this disease. So there's a similar problem with the youth, because when I was doing my research for my comments, I did look for that type of information, and I wasn't able to find any. So if anybody knows about any organization or group that's keeping tabs on this, I'd love to hear about it, you know, because I wasn't able to find that much information. But we do know in the Chicago area and in the state of Illinois, a lot of young people are getting sick, and some of them are dying.
Absolutely, Frank. I think that's similar for Chicanos in Los Angeles and around the country as well. Masao, would you like to add to any of that?
Well, actually, if it's okay for you, I wanted to add a little more on the previous question about indigenous peoples. Sorry, I was about to say something, but I was trying to get it straight in my head. But what is the biggest problem, of course, is that most states are not reporting on Native peoples or breaking it down. They're in that other category. But in the states that do, we can see Native Americans having rates of infection and death that are at least as bad as African Americans, about 3 times the average rate in New Mexico and Arizona. These are very important states because they have such a large number of Native Americans, and especially people who live on their historic lands. In both states, the infection and death rates are about 3 times normal. And I mentioned earlier a little bit about the Navajo Nation, but actually if you took the Navajo Nation as a state, its outbreak would be in the top 3 worst in the country in terms of rates of infection and death, along with New York City and New Jersey. And I think part of the problem, it's also with the media. The media is centered in New York City, and so you see a lot of pictures of the suffering going on there. I'm not trying to undercut their suffering at all, but you just don't see the same attention being paid to the Navajo Nation or other Native peoples.
Absolutely. Thank you so much, Frank and Masao, both of you, for expanding, Masao for expanding on that, and also Frank to speaking about the age of the people who are currently being affected. We still have some time. We're still underneath the 1 hour limit that we had ideally wanted to be under. Again, if we need to, we can extend this past the hour, but a lot of really good questions are coming up. Remember to share this live stream so that other people can have the opportunity to ask Frank and Masao really good questions like you all have been. I'm going to go ahead and ask another question if that's okay with y'all. It looks like, we have some students who are watching this, and it just so happens that you all are awesome when it comes to having answers for a lot of like the younger people, right? So one of the questions that someone asked is, how are oppressed nationality students in particular impacted by the extended closures of schools and possible future cuts to education? I do want to say that we actually have Masao, who is a professor and is firsthand affected by this closure and the stay-at-home ordinance that is keeping us safe. So I'll turn it over to you all so you can answer this awesome question.
Well, actually, I was wondering if Frank I'd be more than willing to talk about it at sort of the college and university level, but I was going to ask if Frank wanted to say something about the impact on oppressed nationality students and parents at the more at the K through 12 level, because I'm not as connected locally with what's going on. So if that's okay, maybe we should start off with that, because that actually affects a lot more people. And then I'll be willing to talk about the college students right after that.
Sure. Well, again, I'm speaking from the swamps here in Chicago. The closing of the schools had a really dramatic effect particularly on people of color here, who live mostly in poor communities. Most of them live in poor communities, barrios and ghettos, and you know, one impact it had has been talked a lot about in the media, but nobody's really, there's no government agency that I know of that's really addressing it, and that is that you know, these kids were being fed very important meals when they went to school, and so that stopped, you know, and while there are some food pantries that's giving out food and whatnot, you know, once again we see the government, you know, not really acting and stepping up and doing what they should be doing in these situations. You know, a lot of these kids are come from families that's on food stamps. As you know, they haven't been increasing the food stamps. They talked about doing it, but it ain't been done. And also, a lot of them are homeless. You know, nobody talks about the homeless kids who go to these schools. You know, so it's had a very devastating impact on the urban poor in Chicago in terms of the closing of these schools, and that impact is not being addressed at all, as far as I know, by no level of government, city, state, or federal.
Yeah, absolutely, Frank. You're right about that. And then at this time, Masao, did you want to go ahead and provide some of your viewpoint on this question?
Yeah, I'd like to add to what Frank said. I think the point he made about the growing hunger among many of the young children who were in schools is important. And not only has the government not expanded the food stamp program, actually up until the beginning of the pandemic, there were active efforts by the Trump administration to further restrict the food stamp program by instituting work requirements and things like that. So what that means is it may limit the ability of people to get food stamps, the ones who need it most, because they're out of work. Frank mentioned the homeless students too, and one of the things that the official homeless data that the federal government releases is undercount in many ways, of course, but it really only even tries to count people who are actually on the street or in a shelter. And what it doesn't count are the millions of families who basically don't have their own homes, so they're couch surfing with friends, with relatives, etc. And when you look at the data, but the school districts do track that because they need to know, do their students have a place where they can do homework? You know, do they have a place where they can sit aside and read? And actually, it's close to 1 million kids, more than the official number of homeless, according to the federal government, that school districts have reported as as basically living with someone else. So they're not out on the streets, but they don't have their own home. They don't have their own house or apartment or place to stay. And so this means that there's, millions of people, probably up close to 3 million people who are actually homeless in the sense of either being on the street or being literally one step away, basically being one relative's goodwill away from being out on the street. Another issue is basically all the schools have tried to go to online learning, and there's a big issue, which schools can partially compensate for, that many students don't basically access the internet through their phones, and they don't have any kind of larger device, which, for talking and any kind of vision assisted communication, it's fine, but for actually studying, doing assignments, phone really doesn't cut it. And the thing is, even though I know schools in our area, many of them are giving out tablets, but the big problem is lack of internet access, right? And that's the thing where a lot of people sort of compensated in the past because they would go to the library or they could go to a coffee shop, and get public or whatever, not so public Wi-Fi. But that you can't do now if you're in a home without internet access. So a lot of the so-called digital divide between students who have internet access and a computer and those that don't has grown even wider during this period because, of course, it's the low working class families, oppressed nationality families that are most likely not to have decent internet access. I think at the college and university level, it's colleges and universities across the country have switched to some kind of online learning. This is, I know at my own college, the administration has always been actually trying to push this form because it's cheaper. It makes it easier to use part-timers and temp workers. And they're even have introduced or trying to introduce over faculty opposition these online laboratory programs that try and say, oh no, you can teach your lab classes online, which, I mean, that's the whole purpose of a laboratory is to have hands-on experience, and you can't really do that online. I know there's been efforts at some places to actually try and get tuition refunded because, especially this I know has come up at some of the more elite schools, but a lot of the elite schools it's not what you learn, it's who you meet at these schools, like at Stanford. And when you're online, you're not meeting the sons and daughters of the makers and shakers and doers at the highest levels of the economy. So these students want their money back. But I think the biggest threat, because most students are attending public colleges and universities, is the what's going to happen in the fall. More and more schools are reporting that they're going to still do online education, which again, we still have that digital divide that I mentioned for the K through 12. And again, students used to be able to compensate because they could get on the internet at the school library, if not their local library. Well, that's out. And then because of the austerity measures I mentioned, I expect that there will be major cuts attempting to be enforced on schools and colleges throughout the country. And this will mean both, hiking tuition, possibly even, and cutting programs for college students, and then trying to force takebacks for teachers and staff under the guise that, well, this is an emergency and we have no money, so we want to, enforce a cutback or break a contract or not give you a new contract, as the case may be. So I do think for the colleges and universities, students need to try and get prepared for a wave of cutbacks coming in the fall.
Awesome. Thank you so much, Masao. You said a lot of the things that I had wanted to include, but I don't have to anymore since you already touched on them. Thank you both so much. And we are 6 minutes away from the 1 hour deadline that I had set for us, but it looks like we do have a couple more questions, and I'm going to ask you all some others of those. And again, if you're just now tuning in, this is definitely our Freedom Road Socialist Organization talk on the pandemic and racism and how it can equal our genocide as oppressed nationalities. Make sure that you share this so that others have the opportunity to find out about what we're talking about, and also a chance for them to ask questions to these amazing speakers who are Frank Chapman and Masao Suzuki, who are tuning in live from Chicago and also from the San Francisco Bay Area. And I'm in Los Angeles. But I have a really good question that someone else asked. All of these have been amazing questions. And that question is, can you think of any examples of solidarity between labor and oppressed nationalities during this crisis. And I'm going to say it one more time. Are there any examples that you know of between labor and oppressed nationalities in this crisis?
Yeah, I have one example. I keep talking about Chicago because that's where I live. Yeah, we just recently had a union, a local here, SEIU local 73. They just yesterday, I believe, they endorsed our campaign to get the torture victims released from prison. And it's particularly important that they would express that solidarity with us now, because the prisons are in fact death traps. This is one of the most inhumane crimes against humanity that I've seen in my lifetime. The governor of this state and the elected officials of this state also bear some responsibility in this. They are just letting those people stay in those jails and those prisons, waiting on this virus to infect them and kill them. You know, they've let a very small number of people out, but they've let not one torture victim out, not one survivor of torture. These are people who were tortured by the Chicago Police Department and sent in those jails, although they committed no crime. They were tortured and forced to sign confessions. Some of them have been locked up for as long as 30 years, like Gerald Reed. And so it's very, very important that the Service Employees International Union, Local 73, has joined with us in calling for the freedom of these prisoners. And in fact, the president of the local is going to call the governor tomorrow. And we wish we could get all of the labor leaders in this city to do likewise. We also need all the elected officials to do likewise. But let's just talk about the labor right now. Everybody in the labor movement should get involved in this, because this is a crime against humanity to let those people stay in there. And most of the people in the prison are in there for nonviolent crimes. They always bring up this question about they don't want to let the violent people out. If they don't have the death penalty, that's what you're giving them by letting them stay in there. The death penalty in Illinois is about, but even if they had the death penalty, it's a violation of their humanity to leave them locked up in conditions where they don't even have adequate soap and water. They can be infected by this virus, and they're starting to die. People are starting to die. We've heard some real horror stories coming out of Statesville prison, and we've heard some real horror stories coming out of the Cook County Jail. We haven't heard anything from the juvenile jail because we have no way of communicating with them. But I just want to say it again. We think it's very important for the labor movement to take a stand on this, as well as everybody else.
Thank you, Masao. I feel you on that. Los Angeles is another. Go ahead.
Also, the unions around the healthcare workers have been vocal. I know the union that I used to belong to in New York, 1199, local 1199, has been vocal around the healthcare workers at Mount Sinai Hospital, and in fact, a number of the private hospitals, Presbyterian, Beth Israel. Well, I think they closed Beth Israel, but a number of the private hospitals in New York, the union has been active in dealing with that. And also the nurses union just recently went down to the White House, had a, they respected social distancing and all that, but they had a picket line protest out in front of the White House, telling President Trump to knock it off, quit talking about what heroes they are, and do what he needs to do. You know, he's talking about they're heroes, but he's not sending any PPE to these workers. He's not giving them any masks. He's not giving them the tools that they need to work with to help the people who are sick, like ventilators and whatnot. He's just all mouth, and so they went down there and they protested against him. And I see that the nurses union is active, I think, all across country.
Go ahead, Masao. And thank you, Frank, so much for that.
Yeah, and I'm really glad Frank's talking a lot about Chicago, because it is one of the centers of mass struggle, has been for many, many years and still continues under pandemic condition. I just wanted to mention in general terms, this idea of solidarity is very important because one of the views we have in the Freedom Road Socialist Organization is that the way we're going to achieve socialism is through a broad united front, but at the core of that needs to be the unity between the working class and the oppressed nationalities. And we had that strategy because we felt both workers and oppressed nationalities, African Americans, Chicanos, Central Americans, Latinos, Asian Americans, Arab Americans, and Native peoples all have a common enemy, the monopoly capitalist or the 1% or the very rich, with its representative in chief right now, Donald Trump, himself a billionaire. But I think right now we face the same, you might want to say two enemies. One hand, this class that has basically disarmed our country in the face of the pandemic, and then, of course, the virus itself. And while we've talked a lot here about the disproportionate, uneven effect on oppressed nationalities, although I haven't seen the data yet, but there is definite disproportionality in terms of the class effects of this pandemic, in terms of people's access to resources, to testing, to healthcare. Because there's been a whole development recently of this so-called concierge medical care, where basically, if you're wealthy enough, you can basically pay to have your own private doctor, who's at your beck and call, because you're paying for everything, no insurance, no regulations. And so, of course, they're going to get the tests, they're going to get the better medical care. And in fact, there's a well-to-do community here in California that they raise private money. They're going to test everybody in their town. It's only a few thousand people, but that's the kind of thing that we can't do, workers can't do, oppressed nationality communities can't do. So as long as we have Frank started off talking about this, for-profit healthcare system, then there's going to be those definite class inequalities as well.
Thank you. And I actually wanted to touch base on that as well. In Los Angeles, and my own husband is a UPS driver, there's a lot of delivery people around the country who are delivering essential goods in some cases. And in other cases, people are buying a lot of gym equipment, right? But a lot of their demands have been around their local demands within these warehouses. And a lot of these drivers are demanding that they have masks or gloves. I have some friends who live in Florida, and they're working inside the warehouse. And in a lot of cases, they're not even having them separate amongst themselves. They're not separating them so that they can ensure that they're 6 feet apart from each other. And they're also not giving them any masks or gloves. And that's a huge safety concern, especially if they're turning around and sending these boxes out to different people around the country. My own sister lives in Washington State, and she's also inside of the warehouse. And there is no measures to make sure that the workers are safe during this time. I mean, there's different things there's different reports that are saying that the virus can actually survive for an extended amount of time. And so that's a very, very common and basic thing that we should have for everybody, which is gloves, masks, just starting off with that. And one of the local demands in Los Angeles that I've heard in regards to UPS is that, the trucks be cleaned after every single shift. And that's something that still continues to be a high concern for people, and it's not being done. And that's just one industry, right? We're only talking about the delivery people, and Frank and Masao talked about others. But this is, the current businesses and current companies and essential workers who are still working during this time, especially those who are educators or nurses, those who are involved in healthcare. They're brunting the effects of this, and their safety is also at risk. And we have to keep united. As a communist, the only way that we're going to be able to free all of us is, like Frank and Masao were saying, if we unite our struggles together, which is the struggle to free us from oppression as oppressed nationalities, and to fuse it with those who are working class of all different nationalities, to make sure that we can free ourselves from the same enemy, which is imperialism or capitalism. So thank you. I do want to say that we've hit the 1 hour mark, and we've even extended it by 6 minutes. If it's okay with you all, let us know. You can comment right now, and of course, share this very important talk that is coming to you by Freedom Road Socialist Organization members Frank, Chapman, and Masao Suzuki. Let us know if you want it to go on for a little bit longer. It's 1:06. I think we'll keep going until maybe 1:15. And there are some more questions, so I'm going to go ahead and ask another question real quick. It looks like people wanted to know, what are your thoughts, or if you have any comments, on the reactionary protests that are calling for all the businesses to open up as if there's nothing that's happening right now? Do you have any comments on that, comrades?
Well, I think it shows a certain recklessness in terms of the White House, and because most of these people who are really out there rallying to reopen are they're followers of Donald Trump. That's his base. The governors who are leading the charge on this, those are his people, and this is what he has been pushing for now for over a month. He was going to open it up for Easter, remember? So this is a very dangerous thing, and it shows that in the United States right now, there's a section of the ruling class that really is willing to sacrifice on the Wall Street altar human life. They're willing to allow tens of thousands, maybe even 1 million or more people to die so that they can have their profits. They're more concerned about their business than they are about human life. So some of the worst aspects of this system is surfacing right now, because they're saying that they don't care about the people dying, and they think that this is gonna hit mostly poor people and people of color anyway. So this plugs into the genocide part of it. So let them die. We gotta get our business back. That's the way they're thinking. And if you listen to them talk, that's basically what they're saying. They're basically saying, well, so some people are gonna die. So what? We want to get our businesses going because you've closed our businesses down, and we're not making any money. Now if some people got to die for us to get the businesses back open and running, then so be it. And Fox News has been leading the charge on this, but so has Reagan. He's been giving daily press conferences, which are really nothing but political rallies, where he's been urging people to do these kinds of things. So this is part of a organized reactionary attempt to to sacrifice the lives of thousands of people, maybe even a million, if they don't really care, in order to keep their businesses going. That's what this is all about.
Just want to add to what Frank said. I mean, it is, Trump followers, and I'm not surprised at all. You can see pictures of like Confederate flags flying at some of these rallies, and we know what that means when you're flying the Confederate flag, one step away from bringing out the white hoods. There's a couple of things I want to add to what he said. I think, unfortunately, there is a whole section of the ruling circles of the wealthy capitalists and billionaires have basically turning away from science for a while now. I think it had been seen the worst in terms of all the climate change denialism, and it partly reflects the interest, especially of the coal industry, who are like, we want to keep burning our coal so we can make our profits, and we don't care about what happens to humanity or the planet. And these are, close friends of Donald Trump. And I think the same kind of anti-science views are coming to the fore here in terms of opposition to taking public health measures to the pandemic. I think it's also, and it's not unusual that people are doing this or ignoring the lessons of history, because in fact there is history. We had a bad pandemic in 1918, the first instance of the flu, which it sort of devolved into the annual flu we get now. But when it first hit around the world, it killed millions of people. And there are also differences here in the U.S., definite differences between cities who shut down early and staged shutdown. And they didn't do it to the extent we're doing it today, but at least they stopped all public events, big events, mass gatherings, and those that didn't. And the cities that did take these public health measures not only had fewer deaths, but their economies bounced back faster and better than the ones that tried to stay open during the 1918 pandemic. So there's a lesson from history that people are denying. And then, anyway, let's leave it at that.
Awesome. Thank you, Masao, and thank you, Frank, for answering that awesome question. We are seeing, unfortunately, a lot of protests around the country that are coming from these horrible people who think that, it's a hoax, there's nothing going on, and they even sometimes end up with the COVID or coronavirus right after. So let's not do that and endanger other people when you might think that just business is more important than people. It's 1:13 my time in Pacific time. I know that in other parts of the country it's a lot later than that, 2 hours or 3 hours more. But I do want to say that there's another awesome question that I would like for us to address before we end. And if you want to, you can try to make it one last time to see if maybe your question will be asked. Share us so that other people have the opportunity to maybe have their question be the very last one. But I'm going to go ahead and ask this one to you all, comrades. May 1st is around the corner, International Workers' Day, and there are many events that are being organized around the country. If you know of any events that are happening in your city, what are they? And I do want to say that I know that we kind of answered this question before, but there are many things like many different types of actions that you can do. Like Frank spoke about the ones in Chicago that are being done to make sure that prisoners can be also considered when it comes to this pandemic. And there's many that have happened around the country. Right, we have St. Paul or Minneapolis, Minnesota, where there's demands to make sure that the undocumented within the ICE detention centers or the concentration camps also be freed from this time. I did also want to say that there have been many protests that have resulted in better conditions for their workplaces. Like in Tampa, there was a UPS warehouse where workers got together and they staged a very safe way of having a protest to successfully win masks and gloves for their work sites. So there's many things that people can still do. And May 1st is such an important time. It's a traditional day where the working class comes out. After 2006, the mega marches resulted in making sure that May 1st was centered around also the undocumented and demanded for immigrant rights, because in 2006, there was going to be a horrible bill that was going to be introduced. It did get introduced. It was called the Sensenbrenner Law after Sensenbrenner, who was a powerful politician and a bigot who wanted to make sure that the undocumented were punished for simply living with other people who were not undocumented, and many other things. So now talking about May 1st, is there anything in your city that's happening or any upcoming events that are happening after our talks today that people should know about?
Well, I was told you already have the one in Chicago posted up, right? It's on the screen. Okay.
Yes, that's correct. I see it on there, Frank.
Good.
All right. How about you, Masao? Any other events that are coming up that people should know about?
I'm participating. Our union, my union, is actually doing an event on May Day, but it's mainly going to be about the conditions at the community colleges where I work. So I'm not sure if anyone has interest in it, maybe you could note it to Sol and she can pass it on to me, but I don't even have the information yet. I was just asked to speak. I'm sorry, I've been so caught up in just my work that I really have been swamped in terms of I haven't been able to keep up with local events. I do want to say, though, that take advantage of your talk about May Day. May Day is a holiday, of course, that began here in the United States by a general strike started or centered, perhaps, in Chicago. And it was a struggle for the 8-hour day back in the 1880s. And since then, it's spread around the world. And as Sol mentioned, it's been revived here in the United States in a mass way by the immigrant rights movement in 2006. But I do want to stress that May Day is a day not only to recognize the struggles of the working class and the struggles of immigrants here in the U.S., but also to be able to look around the world and realize that people who are struggling in other countries are our friends, struggling to free themselves from the shackles of U.S. or other imperialist rule, and also that there's lessons to be learned from other countries. There's a lot of bad press in the United States and other countries about all the errors that China made handling the pandemic. Well, of course they made errors. Of course it wasn't perfect. If it was perfect, they wouldn't have been the leading in the number of cases and leading in the number, and more than 4,000 people wouldn't have died if they were perfect. But the question is, given that they had the first and major outbreak, how did they handle it? And I think it's important to look at that. And then even beyond that, the country that had the second biggest outbreak early on was South Korea. It's definitely a very intensely capitalist country. And yet they were able to overcome it largely through large-scale testing and contact tracing and isolation of people who were infected, not just telling them to stay at home, where they could, they could also infect members of their family. And so there are other examples of how countries overcame large-scale outbreaks. And so I think May Day is a time to remind ourselves not only of the struggles around the world, but some of the progress that other countries, and particular socialist countries, have made in fighting the pandemic.
Yes.
Would you like to add anything to that, Frank, at all?
Yeah, well, I agree 1,000%. And May Day is historic International Day of Solidarity for workers throughout the world. And it's a time that we express our solidarity, and there's no time better than now. Although this is a real bad time, it's also a time of great opportunities for our class to rise up and correct the injustices that have been perpetrated against us, ever since capitalism has been on the face of the earth. So we can rally the workers this May Day to address these problems.
That's right. Thank you so much, Frank and Masao. It's been such an honor to moderate you both speaking and bringing such knowledge and fervor for making sure that we can change our conditions despite such terrible conditions that we are currently all living under, especially as the working class, as oppressed nationalities and people fighting for a better future. It's now 1:21 in the Pacific Coast where I'm at, and I know that it's later where you are, Frank, and even later where people are on the East Coast. But we do want to thank everyone for getting on today and listening to us talk about, the pandemic, which is very frightening, but there's still ways that we can manage to fight back against these efforts of, keeping us down. Genocide is very real for us, especially when the U.S. as a whole isn't doing anything to make sure that we're all safe and to keep us alive during this very scary time. And I know that already at the comment section, it's been included all the different events that are happening around the country. So please check those out. There's going to be a lot of events that are still coming up because we are constantly busy as Freedom Road Socialist Organization members. So thank you again, everyone. And make sure that if you didn't get a chance to watch this live and you're watching it after the fact, make sure that you stay in touch with us and make sure that you keep organizing, because there are still ways to continue organizing, even though we're a little bit limited in how we normally do it. So there's a new way of staying safe and a new way of fighting back. Thank you, and solidarity with everyone around the world.